Well, March is Colorectal Cancer Awareness Month, and doctors say it's a reminder that one of the most preventable cancers is still one of the most common in the United States. Now, colon cancer affects both men and women, and in many cases, it develops silently with few symptoms in the early stages. But there is some good news. If it's caught early through screening, it's highly treatable and often preventable. Today, we're joined by Dr. Alexis Hawkins to talk about some of the warning signs people should watch out for and when you should start getting screened and why doctors are seeing more cases in younger adults. Thank you so much for joining.
Yeah, of course.
So first off, kind of just give me a background on what colon cancer is.
Yeah, so colon cancer, colorectal cancer is essentially a lot of individuals can get it. The biggest thing is making sure we're getting screened early. And a lot of the recommendations as far as, getting screened have moved to a younger age. So the recommendation is now 45 just because they have, noticed incidences of younger individuals getting colon cancer. So I think it's really important to make sure that people are getting adequately screened.
And any idea why we're seeing the younger ages, getting diagnosed with this?
Yeah, so there's a lot of research out there as far as what specifically causes. I think a lot of it, is the processed food, making sure we're adequately getting enough fiber in our diet, things like that.
And some of the warning signs, I know as I was doing just some research before you got here this morning that, this is a highly treatable diagnosis or disease if it's caught early. So what are some of the warning signs?
Yeah, so the thing about colon cancer is that a lot of times when we start having symptoms that's when it's at a later stage. Things like blood in your stool, which is a common symptom for a lot of things, but when it's related to, weight loss and other things like that, the biggest thing I think to take away from this is that's why we have screening, because a lot of the times when people have colon cancer and they start having symptoms, it is at a later stage.
And for the screenings, how does that process work? When folks come in, do they just say, hey, I think I have colon cancer or I want to get screened for colon cancer? How does that work?
Yeah, so right now the recommendation is at the age of 45 for an average American is to start screening. That being said, obviously, if you're having symptoms prior, we can start earlier. If there is a significant family history, or if you have a history of IBD or ulcerative colitis, Crohn's disease, things like that. But right now, the recommendation is to begin at age 45.
Wow. And for folks who may not realize or may not know that, this runs in their family, what are some of the questions that they need to ask, if not doctors, their family?
Yeah, having the conversation with your family as far as, and a lot of the time, so when we say screening early, we're talking about first degree relatives. So that's parents, siblings, children. But I think it's also just really important in general to have a conversation with family members regarding, not just colon cancer, but any, history of any diseases in the family.
Absolutely. And so since you're at Prisma Health, I'm sure you see folks come in all the time with these issues. Do you see it as an alarming number here in the Midlands or in Columbia, or is it pretty average? What is it looking like for us here specifically?
Yeah, so I work at Chapin Medical Park in Chapin, and it's not necessarily that we're seeing in a family med office, not that we're seeing increased rates of colon cancer. It's more making sure that as a primary care provider, I'm making sure that people are getting adequate screening. So whether that be a colonoscopy or a Cologuard, having that discussion with them as to what fits right with them and just making sure at the end of the day, the wrong answer is not Cologuard versus colonoscopy. I think the wrong answer is not getting screened.
And I'm glad you spoke about the colonoscopy because I know for a lot of men, we hear that and we're just like, whoa.
Yeah.
Talk about the importance of men actually, going in, because I know being a man myself, doctor is just not something that we typically like to go to, but you kind of have to. It's essential to our lives. So kind of just talk about the importance of men specifically, going to get those screenings.
Yeah, I think, like I had said before, the biggest thing is that with colorectal cancer, a lot of the time symptoms don't start presenting until later on. So I think screening is really important. I I'd say, life is very unpredictable. There's a lot of cancers and illnesses that we can't catch early on compared to, colorectal cancer. We have the ability to screen for it, which I think is pretty awesome. So I think it's something that we should really take advantage of.
Absolutely. And when we talk about treatments,
Mm-hmm.
what does that look like?
So if, as a primary care provider, I put in the order for whether that be a colonoscopy or a Cologuard, and depending kind of on results, whether that be, you have a colonoscopy and they see a polyp, which is a growth. They take it, biopsy it. Depending what that shows will determine, whether you repeat your colonoscopy in 3, 5, 7, 10 years. And you would work specifically with like a GI provider to, go down that path as far as treatment.
Gotcha. And I've heard of a colonoscopy before, but I've never heard of a Cologuard. What is that? Explain it to me.
So Cologuard, you maybe have seen the commercials. Basically, they ship you a box to your house. You provide a stool sample. It's very laid out. It's a lot of very thought out instructions. You provide the sample. I believe they even come and pick it up from your house. You don't even have to go to UPS, drop it off. They test, it's a DNA-based stool sample, so they look for blood, precancerous DNA, things like that. If it's negative, good for 3 years. There's no prep involved, which is a positive thing. If it is positive, though, you do then need to get a colonoscopy. So again, that one is more for average age or average risk 45-year-old individuals. So no family history, no symptoms, no ulcerative colitis, Crohn's disease.
Absolutely. And do you see colon cancer in much younger than 45?
Yeah, and so that was originally the age was a few years ago, the recommendation was 50. They did bring it down to 45 because they were seeing increased rates in individuals. So again, I think not just the screening, but also taking the, prior step, increasing your fiber, making sure trying to eat more whole foods, less processed things, avoiding smoking, alcohol, things like that.
And is there a certain demographic that you see colon cancer kind of in, or is it just?
They've done a lot of research. I think the biggest thing, again, is the screening. So people and demographics of people who aren't getting adequate screening, whether that be because they don't have access to health care and things like that, I think we're seeing the biggest rates.
And to someone who may be watching this who may feel like they have a symptom or they're just scared, nervous, they don't want to know the outcome, talk about the importance of just going ahead and getting it over with.
Yeah, I think the biggest thing, and that's kind of, what I talk to my patients about, I think going in, there's a lot of fear as far as, you don't want a cancer diagnosis. But again, I really just emphasize the point that the biggest thing about colorectal cancer screening is that we want to catch it early. And that gives us the opportunity, especially with a colonoscopy, to go in and not just see it, but also take a polyp that is precancerous, prevent it from becoming cancer. So I think that's pretty amazing.
Gotcha. And when we talk about the screenings, typically how long does it take to get those results back? Because I know a lot of time people, they are biting nails, frantic, waiting on those results. So how long typically does it take to get those results back?
Yeah, so with a colonoscopy, typically your GI doctor will let you know as far as if they saw any polyps or anything concerning during the actual scope. The biopsy itself, it doesn't take too long. The Cologuard, I would say, takes a few days to maybe a week or so.
Absolutely. Any before we go, any advice that you would give out to folks today?
I would just say make sure you're taking full advantage of all of the amazing medical technology that we have. Again, I think it's pretty cool that we have technology to, diagnose cancer early on and prevent it from progressing.
Absolutely. Well, Dr. Hawkinson, thank you so much for joining us. I really appreciate it. And we're going to post this story as its entirety on our website, WLTX.com, so you can watch it and stream it. And one last thing, if folks wanted to reach out to you guys or, visit your office, how can they do that?
So I work at Chapin Medical Park. So if you just go onto Prisma.com and search for Alexis Hawkinson, I am available on there.
All right. Well, thank you so much. And thank you for joining us. We'll be right back after this break.